know, tonight we will be showing off the splendors of what your past donations have allowed Spreeha to accomplish. But before that, last year we had an amazing gala celebrating a decade of Spreeha, and as a Spreeha donor and supporter, that kind of embodied the essence of Spreeha's building block over the years. I think that always brought about a lot of excitement around people coming together and talking, having fun, at the same time learning more about Spreeha, learning what the causes are, learning what the gaps are. And from our very first fundraiser in Seattle's Capitol Hill to last year's, it was always an event that brought people together. But this year we have taken on a little bit slightly different model. But all of you, both as the heart and soul of Spreeha, are still the center of it. And I wanted to kind of take a second uh, to talk about why we're doing it differently this year. Obviously, one of the main reasons was our great commander-in-chief for several years, Firdaus Oneza, who served first as the CEO of Spreeha, but even before that, she was the president of the Seattle chapter and volunteer. She decided to step down, and that was actually not a sudden thing either. It was a couple of years in the making. Oneza needed to focus on personal commitments as well as her other into her consulting company and her career. So it was a couple of years in the making. And Tazin will talk a little bit more about what some of the challenges were finding a local CEO. And one thing that I've seen in the last 10 years as a volunteer and as a donor of Spreeha is that there's a lot of things that a CEO ends up doing. The gala, the evening is kind of the face of it all. So donors and supporters see that, but there's a lot of different things. So without a local CEO, I think it felt kind of prudent for us to focus more on things that keep the wheel going and all the different knickknacks, starting from the registration to budgeting, annual report, uh, 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 talking to the state about keeping the different annexation of Spreeha going. So there's a lot of different desks, and it kind of felt prudent for us to focus on that. So here we are. But for the longest time, I actually have been more excited about the work that goes on in Spreeha. A lot of us have visited the Spreeha locations in Dhaka, but not everybody, not every volunteer, not every donor, not every supporter are able to do it. So a few years ago, we started kind of bringing that element in, and that was very exciting to me. So this new model kind of allows us, and it gives us the opportunity to dive into that more. And along with that, it does allow us to do a few more things. First of all, it allows us to align with Giving Tuesday, which is super exciting. It allows us to kind of align more with partner organizations and platforms like Global Giving. Virtual tours that we will see in a little bit, those are amazing. It kind of brings the focus into all of that. The kind of the new model of the organization brings the synergy together between Spreeha US and Spreeha Bangladesh, which is awesome to see. And last but not least, it brought Tazin back at the helm. It's awesome to see Tazin's, I think we haven't had Spreeha calls with him. I haven't had Spreeha calls with him as much as I have in the last couple of months, and it's awesome to do that again. While it's a loss to not to be able to do it with Oneza, it's definitely a big gain to have be connected to Tazin on an organizational level again more and more. So as I mentioned before, we have a jam-packed evening, and I think I have taken a few more minutes than I planned on taking, but now this is where I want all of you to pay attention, because this is where I give away money. Let's see. There we go. I think that's. Can everybody see my screen? All right. Oh, did I say I'm going to give away money? Oh, no. It's actually, we are going to take money away from you. So that's what I'm going to be showing. So there's a couple of, obviously, we have the Spreeha website that we have had in the past. And you can always come to the website, spreeha.org, go to the right corner, click on donate, and there are several opportunities for your donations. You can pick and choose whichever one you want. But I mentioned Global Giving, and that is an amazing platform. And on Giving Tuesday, they will match all your donations. So once again, they will match all your donations that you give. So the website is globalgiving.org. It's been shared across social media as well as other campaigns, but I wanted to take a moment to kind of show that for a second. So globalgiving.org, and the easiest way is to just go into Explore Project and search by keyword. Just type in Spreeha, and then that brings about the different projects. And you can also, just like the Spreeha's website, you can pick and choose where you want to give. I think, if I'm correct, Tazeen, I think one of the main focus is the healthcare. We have lofty goals for the healthcare side of Spreeha Bangladesh this year, and we want to go there as soon as possible. So the focus is on healthcare, but as always, it's your hard-earned money. You give where you want to, as long as it's within Spreeha. So without further ado, I would like to hand it over to Halimatu Sadia, who is the head of growth in Spreeha, and she will give us some amazing program updates. Halima, the floor is all yours.
Thank you, Zakir. As Halima is setting up, I want to take just a couple of minutes to kind of give a little bit of update and kind of go along with what you have been talking about. So I think the screen is being shared. I hope everyone can see it. So even before we go into the program update, one of the things I wanted to start the day with is, or actually night for you and day for us, is this number. If you look at it, this is the number of people your support has impacted. 702,000 and more. This is just crazy. This is absolutely crazy what you have done together. And I wanted to start today's event with just that. Just let that sink in. I checked yesterday, and city of Seattle, which is the most populated city within Washington State, the city of Seattle has a population of 723,000. So if you think about it, your donations, your support has helped an entire city of Seattle, the same number of population. This is absolutely amazing. And I am forever grateful to each and every one of you for giving this opportunity to all of us to help together and make a significant impact in the lives of all these people. And the way we did it, and Zakir Bhai mentioned that a little bit as well, like that was our first fundraiser, 2009. We were selling food at Microsoft cafeteria. We named it Bangladesh Giving Campaign. The money we raised was the amount we used to start the first clinic that we had. So that was 2009. And then 2013 was our first public fundraiser in Capitol Hill, where I met Shams Bhai and Nasrina for the first time, and then others joined, Onaza, Raju Bhai, everyone. But that was our first public fundraiser. And from there, we went to like our traditional gala fundraisers that started in 2015. Uh, Even though it's been many years, I still remember that night. That was my first one, and what an amazing job Shams Bhai did. I think we raised like more than $300,000 in one night. That was the beginning of where Spreeha got shaped as an organization. Before that, it was we were doing small things here and there. So every time these fundraisers kind of gave support and then helped grow the organization. And finally, COVID hit, and we were all scared, not because just the intensity of the situation, but we needed to do more. The people we worked with had a lot of new challenges on top of what they were already doing. And thanks to Onizapu and team and them, uh, totally converting the entire our gala dinner event into an online experience, and we continued our work based on that. And then last year was our 10-year anniversary, and we ended up doing another gala event. And again, when you raise money, we celebrated together our impact, we continued our journey. However, one of the things that had happened during that event, we also realized that during COVID, Spreeha has kind of spread from Seattle to not just all over US, but to the other parts of the world. We had supporters and donors and friends in Texas and in Dallas. We had a big team in Boston, in DC, in the Bay Area. We had donors from Australia. So all over the place, people were able to join when we did the online event. And as Zaki Bhai mentioned, we had a lot of resource constraint, and then we tried to figure out what would be a way for us to kind of address best of the both worlds. And this year we wanted to, because of that, align with global giving and be part of the Giving Tuesday, because it is a day that is celebrated for the generosity that you all have shown. And it's something that is a global movement. Everyone was aligned with that. And the reason for us to also go with global giving, they have been a big supporter of us since the very beginning. If Zaki Bhai showed the projects we have on their site, but if you go there, you will see we have earned over the years multiple badges and certifications from them. We are one of their top-ranked NGOs. We are physically vetted. Their team has come to Bangladesh to look at our programs, and then that field visit with us. And also, we are certified as an effective organization, using the donations in a very effective way, so that our dollars go as far as it can in terms of helping people. So that was kind of our reason to come together and then celebrate this day and celebrate your generosity, your support, to kind of how we're gonna move forward with that. So now that we know why we wanted to celebrate this day, and we wanted to do it a little bit differently, and Zaki mentioned a little bit of that. We are gonna talk about the program, but also, instead of keynote speeches this time, our keynote speeches would be live from the field. We're gonna go and have a quick visit into different locations where people from the Spreeha field areas will join and give us a bit of kind of like a virtual tour. So with that, I'm going to hand it over to Halima. Zaki, I already gave a short intro. I'll just make another intro again. Halima leads all our growth efforts. That includes like our R&D, thinking of new programs, new funding opportunities. And the interesting story is when I moved back to Bangladesh, Halima was one of the first hires. She came in as an intern. We wanted to create an internship program similar to Microsoft, where we attract the best and the brightest. Halima is actually a valedictorian of from Dhaka University's Gender Studies program. And instead of the traditional route of being a valedictorian and becoming a professor for Dhaka University, she decided to come to Spreeha. And over the years, she has developed many programs herself, including PROCA, the one you hear about. But on top of that, now she is driving all our efforts to take Spreeha to the next level. To you, Halima.
Thank you, Tazeen, for this heartwarming introduction. Hello, everyone. I'm just going to present the impact we had in 2023 till October through your support. Tazeen, can you give back the control to me? I cannot control the screen.
Yeah, I did already.
Okay. Thank you. So, okay, let's jump into the numbers and the impact we had this year. We have been to 14 different locations in 8 districts this year, and we worked in 5 strategic program areas: healthcare, education, skills, community empowerment, and economic opportunities related projects. With 10 impactful projects, we have reached more than 35,000 lives this year, and this has been a big year for us. And thank you all for supporting us, and thank you for making hundreds and thousands of dreams come true this year. So let's move on to our healthcare projects. Sneho Argent Healthcare is Spreeha's own project, and this is our signature healthcare project. And as Tazeen said, we started with a small mobile health clinic in Bangladesh. And that mobile health clinic became a static one in last 10 years and served more than 200,000 patients. So on this 11th year, we wanted to amplify our impact by reaching more people with our quality healthcare services. So we gathered together and we came up with a sustainable healthcare model where we will have a network of 100 community clinics in different underserved areas of Bangladesh. Those clinics will be led by health entrepreneurs, and this way the community will continue to have access to quality healthcare services, and those entrepreneurs will continue to have access to stable income source. And we at Spreeha, we get to move on to new places and serve more and more people with each healthcare center we open in upcoming days. So this year till October, we have established 11 such urgent healthcare center in Dhaka, Sirajganj, and Gazipur. 4 of them are up and running and already serving patients daily. 7 we have onboarded last month, and those will be operational from December. We have served 15,000 patients through our quality healthcare services. That includes direct access to doctor consultation, safe medication, and quality diagnostic facilities. As I said, that these healthcare centers are going to be led by health entrepreneurs. So we have met with 283 of them in the process, and we have discussed how we can make healthcare accessible in their community, how this can become financially sustainable so that they can provide the service for a longer time. They're not entirely dependent on us. And we get to, as I said, we get to move on to new places and serve more people. So this is going to be a win-win situation for us. Let's move on to the next project. We had Drishti Cataract Surgery Project. This was funded by JACO Foundation from Canada. We completed this project in August. So it's surprising that more than 6 million people in Bangladesh suffers from different kind of vision impairment, and 74% are caused by cataract problems. And cataract is considered as a sign of aging in Bangladesh, and people tend to take it as a natural process, and the treatment gets delayed most of the time, proving that 68% of our patients in this project were above 50 years old, and their treatment somehow got delayed. So we organized a vision camp at Faridpur for them. 1,800 people came, they got their eyes checked and screened, and they got prescribed as necessary. We provided free cataract surgeries and post-operative care to 856 patients there. And this was an empowering journey for us, seeing that how vision can improve someone's life overnight. So having said that, let's move on to our education projects impact this year. We had Duronto Education for Children project. This is one of Spreeha's signature project and core funded project. This project has 4 components. We have preschool for 3 to 5 year old kids to ensure proper early childhood development care. We have after school program for school going students. We have parental counseling so that parents ensure proper childcare both at home and also at our facilities. And we provide scholarships so that students can continue with their education. This year, we had 50 students attending our preschool. We had 30 students in our after-school program. And we provided 48 education scholarships to students to continue with their higher education who are now attending different medical schools, engineering schools, and nursing schools. As we are started working in a new slum areas this year, so our primary focus was on to providing extensive parental counseling to ensure proper child development. And with a new and untapped areas like that, parents really needed a lot of convincing to send their kids to our school on time. So through our parental engagement services, we have got connected with 100 parents this year. We sit with them weekly and discuss how we can make their children's life more encouraging, and how we can keep intact their playfulness. So let's move on to our newest addition to our education initiative. The STEM education is funded by Rohim Family Foundation. In Bangladesh, recently, in last 2 decades, we are seeing a decrease in science enrollment, and that has come down to below 20%. And this is happening due to different resource constraints. We do not have proper infrastructure at the school. Teachers are not trained in that way. So through this project, we have started working with teachers on capacity building in scientific teaching. We have started sensitizing parents so that they encourage their kids to study science. And we also got connected with students and training them in scientific learning in a fun and relevant way. So this project is still in its pilot phase. We are working with one school in Chattogram. We got connected with 21 students and 25 parents and teachers. We developed 4 modules for them on physics, chemistry, biology, and maths. So they will be with this project for till next December 2024. And starting 2025, we are expecting that we will have a full-fledged program serving our students' need and encouraging students towards scientific learning. Having said that, let's move on to our skills training projects. So we had Microsoft Nurturing Communities program this year. This is funded and supported by Microsoft. We worked with 13 students in Noakhali Science and Technology University. Microsoft employees trained them in different technical skills. Students just got done with their exam last week, and all of them passed. And we had a graduation ceremony, and in that ceremony, students were awarded with Microsoft Geek Academy certification. Now they will have access to additional 6 months of career mentoring from Microsoft employees. And after completing that, qualified candidates will have opportunity to apply to different jobs that are available at Microsoft and their partner organizations. Let's move on to our next project. We had English and Digital for Girls Education project this year. This project is funded by British Council and HSBC. In this project, we have 1,440 girls with us who gets weekly training in English language, digital skills, and entrepreneurial skills. For every 10 girls, we have a peer group leader from the community who learns directly from British Council's trained trainers, experienced trainers, and that girl then come back to the community and cascade her learning to her club members. We have conducted 1,300 such sessions with these girls, and they had additional exposure to different networking sessions, different workshops by the funders and inspiring leaders. They even attended more than 10 networking sessions with HSBC and British Council. And by getting access to this kind of tools, our girls are now empowered, and they do not hesitate to carry out a conversation in person and both in and in bigger stages. Having said that, let's move on to our next project, Progga, Empowering Adolescents. This is another one that has been like that has touched hearts of all of us, and this is a core project funded by Spreeha. We have 332 girls in our community-based girls clubs. And there they learn about leadership skills, financial literacy. They get access to different tools to combat the social barriers they face every day. And this year, we have conducted 486 sessions with these girls. We have added a new component. We have added a new component this year, that is training girls in employable skills so that they can get access to decent work after they complete their education. So we trained 44 girls in Meherpur and Dhaka. And we provided them with basic tailoring training and fabric dyeing training. Let's move on to our next project in economic opportunities. We had Uday Economic Empowerment Project this year. This is also funded by Spreeha Foundation. We provided a small grant and technical support to 42 entrepreneurs, and this is a milestone project for us, as we have started for the first time directly contributing to agricultural sector of the country. So out of these 42 entrepreneurs, 40 are farmers and agri-entrepreneurs who have different paddy fields, crops field, and vegetable fields. And they also have cattle farms. And we also helped an IT entrepreneur in setting up his computer training center. We helped a female entrepreneur in setting up her electric shop. We are also supporting them technically with different regulatory issues, licensing, business model development, marketing strategies, and everything. Let's move on to our community empowerment projects. So we had 2 projects under community empowerment this year. We had a project with ActionAid Bangladesh. Accept project. This project is centered around sponsored children and their communities. The project aims to empower the community and those children to have access to an enable environment where they can grow and they can avail their rights, and they can grow, become a leader, and serve their community, give back to their community. So we have worked with 952 sponsored child this year. We have engaged 2,640 community members in different women groups, child forum and youth groups. And we completed this project in August. So community awareness and motivation program. This is a cross-cutting activity to all of Spreeha's service-oriented projects. This is Spreeha's own program. And this has been for the last 10 years. Our community mobilizers go door to door, make community members aware of their healthcare, education, skills training, economic opportunities, and lifestyle choices. Those are related to empowerment. We have reached 10,433 members this year through our door-to-door awareness services, different stakeholder meetings and group meetings. We have also served 2,237 mothers and children through our maternal and child health care services. We form a community-based moms club here, where pregnant women can come and get access to peer support, preliminary health screening, and we also have we also conduct growth monitoring for kids under this component. So we had a new addition to our community awareness and motivation program. That was our youth group. We had 200 members in this youth group, aged 18 to 35 years old, whom we helped and mobilized to take responsible action for their community. So our goal is to empower and transform these communities through our awareness and engagement services, along with all our service-oriented projects. So yeah, that was all from me. I had to share with you all. Thank you so much for joining. Over to you, Tazim.
Thank you, Halima, for a great summary of a lot of projects. Usually, over the years, previously, we only used to talk about projects that we self-fund. But as you can see, we have also other kind of donor agencies who provide us fund to run specific programs. And that kind of gives us an opportunity to have a higher and a greater impact on the projects we're doing. And you saw how we had all these projects and programs that were funded by us, funded by groups like British Council, Jacob Foundation, HSBC, Give to Asia come together and have a combined impact of more than 35,000 people this year. Now the next one is our exciting part, and it's basically our live tours. So for that, first of all, what we'll do is we'll go to 3 different locations. And the first one, we will go directly to Toma, who is in our preschool right now. A little bit of short intro about her. Toma has been with us for more than 3 years now, and she focuses on our education part. She has a bachelor's and master's from Dhaka University's Institute of Educational Research, and from there our primary focus was pre-primary and child psychology. So she fits right in leading the preschool programs. Toma, I'll go directly to you now from the field. And again, there could be some internet hiccups, so stay with us. Thank you.
Hello everyone, I'm Sanjita Mahmoud Toma and working in Spreeha's education program. Today I am live from Spreeha's preschool. Let's have a tour to our preschool activities. ensure early childhood development and school readiness of 3 to 5 years old children in underserved areas of Dhaka. Through this program, we make sure children have access to learn through play, interact with peers, and grow as confident individuals. As you know, use of various cards, puzzles, and blocks make learning easier and more enjoyable for the children. Here, our preschool teachers is teaching alphabets, especially Bengali alphabets, with the help of cards. In our preschool, no child is forced to sit in the classroom and study. They have the freedom to play with various play materials whenever they want. Here, one of our preschoolers is playing with a wooden puzzle. By playing with this puzzle, she can easily learn numbers, shapes, and colors. Hello, Samia. Additionally, our preschoolers learn to recite poems with proper expressions. Among various activities they enjoy, their drawing and story time session, the for us. হ্যালো ইয়াসিন, কেমন আছো তুমি? তুমি কি আমাদেরকে একটা কবিতা পড়ে শোনাবে? কি কবিতা শোনাও তো, দাঁড়িয়ে বলো। সবাই আমরা একটু তালি দিই ইয়াসিনের জন্য। থ্যাংক ইউ ইয়াসিন। এখন আমাকে আচ্ছা, এখন আসবে আমাদের আতিক বের করো, সিলভার বের করো, দেখো করে তোমরা দেখো দেখেছেন ছবি? That's all from our classroom activities. Now we will move to our play zone. Recognizing the importance of play, we engage our preschoolers in daily playtime after their classroom activities. Here we can see how our preschoolers are enjoying their playtime. That's all from today. Hopefully one day you will come and see all these activities in person. Thank you.
Right. Thank you, Thomas, so much for a live tour of our preschools. Next, we are gonna go to one of our healthcare centers. And for that, we will have Dr. Sajjad, who will give us a tour. Sajjad is a trained physician. He finished his MBBS from Dhaka Medical College. And after that, he got a master's in public health. And like any good doctor, he decided that it's better to focus on preventative care and public health, and has been with Spreeha for a long time. and he also used to manage all of Spreeha's healthcare projects. Today, he's gonna give us a tour of one of our clinics, the new Sneha clinic that we are building. On to you, Sajjad.
Thank you so much for giving me the floor. Hello, everyone. I'm Dr. Shazat Hussain. Today, I'm thrilled to take you on a live virtual tour of one of Spreeha's Sneho Urgent Healthcare Center right here in Kalachapur, Dhaka. And of course, this is an opportunity for me to show firsthand the impact of our healthcare initiatives, and I'm very excited to share it with you. First, let me give a small background that in urban Bangladesh, solutions for urgent healthcare needs often fall short. Individuals with maybe a minor cut or burn, or even with simple fever, cough, these kind of problems, they often end up in emergency rooms at big hospitals, which leads to longer waiting times, extra hassle, and of course, delay in their treatment. The second problem is not only in Bangladesh, this is a worldwide problem. The overuse and misuse of antibiotics leading to antibiotic resistance. This is a significant health concern. And the third one is, we always say in medical science that early diagnosis is very important. It's kind of inevitable to start treatment for majority diseases and maybe prevent a lot of disasters. And for that, diagnostic testing is a must, and commuting to reputable diagnostic adds healthcare to healthcare costs, making them unaffordable for the underprivileged people in Bangladesh. There are cheaper local alternatives, but often they compromise the quality to make it cheap, of course, raising doubts about their reliability and accuracy. But here at Spreeha, we identified these challenges and decided to act. Our urgent health care project named SNEHO, meaning affection, is designed to provide a one-stop solution for all these health problems. Let me walk you through the SNEHO urgent care. And of course, I'm trying to give you an experience what people get. This is the doctor chamber. Of course, at this moment, we don't have any doctors in the morning. The doctors come in the evening time. So this is where the patients lie for general examination if the doctor needs to do that. Then here we have a place where samples are collected for diagnostic purposes. And of course, we have Parvati here, who is also running the center, and this actually leads to another social issue we are trying to address. That is, of course, we always are a big flag bearer of women leadership, women entrepreneurship, women empowerment, and this is of course contributing to that. So পার্বতী আপা, আপনাকে যদি ছোট করে একটু বলি যে কি ধরনের টেস্টিং এখানে আসলে বেশি হয়।
আমাদের এখানে ডায়াবেটিস হয়, সিবিসি হয়, আর হচ্ছে ডাব্লিউবিসি হয়।
Okay, so I was asking her about what kind of common tests are being run here. So all kind of common tests like diabetes, complete blood count, etc., etc. So here we have a wet machine for, and also the nebulizer machine, which all addresses the urgent healthcare needs. And right beside that, we have a waste bin. You can see it's color coded. Of course, we are trying to address the medical waste management thing as well. Parvati, please, if you can join us because you are running the center. Of course, this is the pharmacy part, and Misbah is here. Except the over-the-counter drugs, our pharmacists ensure responsible dispensing of medications to avoid overuse and misuse of antibiotics. Those are the messages we want to convey to the patients, that without prescription, you cannot have any drug except the over-the-counter drugs. So, পার্বতী আপা, আপনাকে আরেকবার যদি একটু জিজ্ঞাসা করি যে আসলে এখানে মানুষজন ওষুধ যে নিতে আসে তাদের কাছে, মানে যে আমরা যে বলি যে প্রেসক্রিপশন ছাড়া ওষুধ দেয়া হয় না, এই ব্যাপারগুলোতে তারা কিভাবে আসলে রিঅ্যাক্ট করে?
আমরা খুব ভালো রিঅ্যাক্ট করি।
ওকে, সো মানুষজন এখানে কমফোর্টেবল যে প্রেসক্রিপশন ছাড়া, কারণ বাংলাদেশে কিন্তু আমরা দেখি যে প্রেসক্রিপশন ছাড়াই আসলে আর সে বলে আমার জ্বর হয়েছে, ওষুধ দেন, এই ধরনের ব্যাপারগুলো, তখন আমরা কিভাবে তাদেরকে রিয়াক্ট করি বা তাদেরকে কিভাবে অ্যাড্রেস করি?
আমাদেরকে আমরা সাজেস্ট করি যে আসলে যদি প্রেসক্রিপশন না থাকে তাহলে সেক্ষেত্রে আমরা চাই যে ওনার জন্য ডক্টর দেখায়, প্রেসক্রিপশন নিয়ে তারপর হচ্ছে মেডিসিন।
Okay, thank you so much. So I was asking that here there is a social problem. You can say that people come and ask for random medicines like antibiotics, and we also try to educate them and say that this is not possible. Of course, you need a prescription to have antibiotics. So I'm going outside of the center at this moment. This is a closer look at the community. And this is our center from outside. Just give me a moment to switch the camera back on me. So that's it from Kalachatpur Sneho Urgent Care. I want to say that Sneho Urgent Care is not just a clinic. It is a dream. It is a compassionate response to the urgent healthcare needs of the community. By addressing the challenges I have mentioned earlier head on, we aim to make quality healthcare accessible to all regardless of their economic status. Thank you all for joining me on this virtual tour. I hope I could make myself clear. And of course, I hope you could come Bangladesh and visit our center someday. And I hope you consider supporting our cause in providing more health urgent care to more communities with Sneho in need. And we know that together we can make a real difference. Thank you so much.
Right. Thank you, Dr. Sajjad. Again, this is one of our big ambitious projects this year, 11 centers already established. Our last part of the tour is we're gonna go to Karishma, who's gonna kind of show us around our girls leadership program. Karishma has been with Spreeha for over 5 years now. She has an undergrad on economics and then did her master's in development studies. And she actually has run everything in Spreeha. Like she was in programs, in communications, in partnerships. She also has managed our social media channels where you see a lot of the updates from our programs going on. So Karishma, to you.
Thank you so much, Cousin Bhai, for the warm welcome. All right, this is Karishma, and I'm live from Spreeha's Girls Leadership Program in Nondipara. And this is such an honor to take you all on a quick tour inside this incredible club. Okay, I'm going to turn the camera now. So here, hello everyone. Hey, oh my God, this is such great vibes. The entire room is filled with such happy faces. Thank you all for being here. All right, so what are you guys learning? Thank you. All right, so this is one of the guidebooks that they follow. It's called English and Digital for Girls Education. And it's funded by British Council. A very, very great project that Spreeha has been working with for quite some time now. Here's the inside look. So this entire guidebook is actually filled with a lot of different unique examples related to English skills, digital skills, and social skills. So let's take a quick look at one of the examples here. Like for example, here in this English part, girls are learning how to speak these words in English. And also in the digital part, they're learning how to create their own CVs in Word documents, which is great. And in the social skills part, they're learning how to prepare themselves for job interviews. Awesome. So like unique examples to really help them master these 3 skills altogether. All right, next up we have, thank you so much, we have Proga Club Handbook. It's It's one of Spreeha's very own publication, and it's also part of Spreeha's Journey of Hope project. Here's the content list inside. We have a variety of topic here, like from leadership to networking to rights and responsibilities to digital literacy and community work, so much more. Here's the inside look. Wow, this book is such a great resource. See, we have a lot of different topics they cover. Here's another example, like how they're engaged in community work and so on. All right, another book. There's another book they're following. It's called Adolescent Club Handbook. This is also one of Spreeha's very own publication, and it's funded by Give to Asia. Let's take a look inside. So here's the content part. Wow, so this book is all about different sets of, like, improving different sets of life skills, from mental health to learning how to properly use internet, to digital literacy, financial literacy, and so much. There is the inside. So these two books, both are Spreeha's own publication, and also one more thing is all the contents inside are all Spreeha's own copyright. So yeah, I guess like all these three books are definitely such great resources for all these young girls to really, improve their leadership skills and, take their skills to the next level for sure. All right. So, okay, now I'm going to quickly turn to this corner where I can see some girls, a group of girls are working in the board. Some interesting things are happening. All right. Hi, everyone. All right, so I love how confident you all are in the board. Wow. So, what are you guys doing, please?
We are learning new words, making new sentence, and discussing in our groups.
Wow, that's awesome. So, like, I can see a couple of words in you guys are also kind of like learning how to communicate these words with each other in groups. Wow, so definitely helping you guys a lot with your communication skills and of course, learning how to work in teams. Oh, that's amazing. Okay, so with that being said, thank you everyone so much. All right, it's been a pleasure for me to kind of like give you all this tour, and I'm just really happy. I'm just so grateful to be in this journey, and I just really hope you all enjoyed it as much as we loved, sharing it with you all. And we really hope you get to meet these young girls, these really aspiring, like, full of potential young girls in person someday soon. Thank you all so much. Over to you, Tazeen.
All right, thank you, Karishma. Again, like, you got to see the Girls Leadership Program. Again, like, every time I think of, like, these groups, like there's like 60 different groups, more than 1,500 girls, and the content, every time I talk to them, the confidence they have, what they're doing is absolutely amazing. And we have like arranged all together with this program and everything like in over 2,000 sessions, so which is absolutely amazing to be able to do it. Thanks to support from all of you and our agencies. So now that like you have seen the three programs, I want to take just a couple of minutes. I know we are running short on time, so just wanted to quickly go through the three different programs you have seen, and these are the three programs where we really would love your contribution to make a difference in 2024. So the first one is the one that Thomas showed, the Early Childhood Development Program. We are going to support 120 children, and for that, we are raising $51,000. Again, like, we have recently, a global organization has recently done a study, an impact study on us, and we have scored more than 90th percentile when it comes to efficacy of the program. And the best part is our peers who are providing similar type of support, we are doing it 1/5 of the cost, same type of programming. So it's really a strong program. I hope you can support this. The next one is our girls leadership program that you just saw. We want to continue this journey with the girls, like 300 of them. For that, we are raising $91,000. This will include all three components you have seen: the digital literacy, the financial literacy, the employable skills training, a lot of entrepreneurial training. And the books you saw came through a lot of research that we have done. It's a copyrighted material, our own publications, and really helps the girl transform their lives completely. And finally, our healthcare program. As I said, our most ambitious project ever. We want to do 20 centers next year, helping 200,000 patients annually. And thanks to Spreeha Dallas team, they have already committed 8 centers. So which is absolutely amazing. Thanks everyone from Spreeha Dallas team. And I am pretty sure we will be able to reach there with your support. We want to have 20 centers. And together, once we have these 20 centers, it will have a collective impact, not just 200,000 people, but how it has a ripple effect on like changing overall the healthcare landscape. And by 2025, we actually want to have 100 centers. That is why it is such an ambitious project. And with that, these are the 3 projects we are raising funds for. I would appreciate everyone here on the field, the people we work for. They will appreciate your contribution, your generosity. So be part of the campaigns and be with us. And we have served 700,000 people. Again, like, think of that number. Our next stop is 1 million. So we want to reach 1 million people. We have a program for that. We call the Million Smiles Dream. This has been something we've been running for a long time. And surprisingly, this year's Giving Tuesday theme is Move 1 Million. So Move 1 Million and Million Smiles Dream, they say the same thing. At the end of the day, we want to help from Spreeha directly 1 million people. So with that, I'm going to hand it over to Zaki Bhai to wrap up. And again, like, thank you everyone for joining in. This has been fantastic being able to share with you all the updates and what we have been doing.
Thank you, Tazin. It was actually very amazing to see all the programs and kind of walk through the different locations. I had the opportunity to visit the location, but it's been, I think the last time I went was 2016. So lots of new additions, lots of new changes. Look forward to going back again. And I must say, the additional, when Dr. Sajjad was walking around in the streets and the background noise of the rickshaws and the cars, that made me nostalgic. So, Dhaka is an amazing city, so it made me reminded me of a lot of great times. Funny how memories work. But But before we kind of end the evening, I know it's been a stretch. I did want to open up the floor for any questions from the audience. So feel free to just unmute and ask your questions or raise your hand if that's what you prefer. So any questions that you'd like to hear from Tazeen or somebody else in the team about, feel free to go ahead and ask.
Yeah, I would like to ask a question. Is it possible to get this particular presentation, especially Halima's presentation, where she covers all these aspects, to get this online so we can actually see
Yeah.
it here and talk to people about it?
Absolutely, absolutely, Shamsbhai. Yes, we will make all of these available. We will send the presentation and also the session recording if someone wants to kind of hear as well as see the presentation.
And also, when you talked of the 3 projects in particular for which we are raising money.
Yes, yes, we will. It's a one presentation. We'll send this all together. Thank you. And please do share with your network. And I know, like, all of you are connected to like our community, and hopefully we can spread the word.
And I think along with that, if you send the whole the video of the whole presentation, that's great. But I think just if we have one video of the Halima's presentation and maybe another one of just the 3 walkthroughs, like I think it will be kind of a bite-sized videos that are more easily consumable.
And
So that would
also,
be awesome.
if I'm going to send this out to people I know, they really don't want to see the whole thing. They want to see the main points.
Exactly.
Thank you. Thank you. We'll do that.
So I did have a question, if nobody else has or are thinking about what questions to ask. So the Sneho Clinic, so you mentioned that we're going to have 20 additional clinics this year. Will it be modeled after the Sneho Clinic, or will there be other elements to it?
No, it will be modeled after the one we have. So it's all of our clinics now have the same model. It's run in a sustainable model. The first thing we wanted to do is, before every year we needed to support the clinic. We have come out of that so that these clinics run by itself. So it's a one-time kind of donation we need to set it up and have it up and going. So that's the model we have. It is run by a health entrepreneur or a center manager who is actually a healthcare professional. So it's not like pharmacies run by shop owners in Bangladesh. So it'll be either a nurse or a paramedic who will run the center, and then we'll have all this support in there. And we're integrating technology in there also. You can go to one clinic, and then the next day, if you go to the other one, you should have all your data available there.
Okay, that's great. And I think I see a raised hand. I think somebody has a raised hand.
I think it's Sabdar. Sabdar, please go ahead.
So I just had one question. So I'm kind of interested in finding out a little bit about the health entrepreneurs. I just want to understand I guess the thinking behind going in that direction. It almost feels like very VC-ish, I guess, venture capitalist-ish, but yeah, I'm just trying to understand the thinking behind that and maybe some examples on the health entrepreneur stuff.
So it's not actually like, when you hear entrepreneur, I know, like, especially being in Seattle, I've probably seen a lot of VC-ish, but these are actually like, so for in Bangladesh, like, the reason healthcare, like all the pharmacies are run by shop owners, because those we say like are health professionals. It could be a doctor, it could be a paramedic, it could be a nurse or medical technologist or a pharmacist. They actually do not have the capital to start like a small initiative like this or run a center like this. So they are bound by just having a job. So what we have done is we do all the setup and kind of like, give them an opportunity to kind of like, run that specific center while we still manage it, like everything, but they kind of are the owners of like, running it. And it's not just like a salaried role for them. So they have an option to run it. And then from their regular income, they can earn a little bit more than what they would have gotten as a job. And if you look at like our centers, for example, we have one center which the health entrepreneur is a dentist, and he had set up his own like dental unit on top of like the setup we have. And then Parvati is a paramedic nurse. We have another center in Meradia where is the center manager is a pharmacist. So it's like that. It is not like a regular VC-ish type of initiative. It's not supposed to grow really big. These are small community centers that will remain at this level and provide support to around 20,000 or so people in 1 year. So around 50 patients a day. That's the capacity they can deal with.
So just to clarify, so Sneho is different, and these centers that are run by these entrepreneurs, they are different, correct?
No, Sneho is just the name of the project. And
Okay.
it's to brand this as Sneho. Like everywhere you go, like whoever runs it,
I can hear you, yeah.
Okay.
Okay,
Can you
Tazin,
show yourself, please?
is Tazin, are you back on, Tazin? You're,
Hey, Tazin, I think we lost you for a minute.
yeah.
be able to hear my answer?
Halfway through it.
Yeah.
Okay. No, I was just saying like it's just the name of the project. The name of the project is Sneho. It's the same clinic everywhere. We just have one type of clinic, but we named it like Sneho to kind of like show that we care for the patients, and that's the name of the project.
Gotcha. All right, thanks.
Awesome. Thank you, Tazin, for the answer. And if anybody else has any questions, now's the time. All right. I think
There. So, Michael, if you want to take just a minute to kind of Michael has recently taken on the role of Spreeha's board chair. So I'm really glad he did that. He actually came to visit Bangladesh and did a tour himself. So Michael, if you could share a few words with us.
Yeah, so it was amazing to see the overview of the programs that we have ongoing and what's the impact we've had over the past year. I really enjoyed the live tours here. Recognized a few of the sites, so it was really good to see those live again. Of course, this is only possible with the donations, with the support we're getting from this broader community, and I'm really excited about what's ahead. So looking forward to working with all of you in the coming year as well.
thank you so much, Michael.
All right. Zakib, I have a request from the team here. If we can take a group photo.
Yes.
Everyone can kindly turn on their camera just for a second for a quick photo. All righty. Thank you, everyone. And Charu is gonna take the picture. Charu, thank you for managing the whole event today from the background. Charu is our communications specialist. And she has been doing all the work, like all the emails, all the event activities you have been getting from Charu and Rocio also. Like, the two of them have been, on top of things and making sure we have a very smooth event.
Here.
Cool. All right. Thank you, Zaki Bhai, again, on to you.
All right. Thank you, everybody, for joining. Everybody in Seattle, for joining. I know it's getting late. Thank you so much, everybody in the Dhaka location. We loved it. We absolutely loved it. It was great to see, all the work that goes sometimes behind the scenes. So it was great to see. Great job, and we look forward to seeing more and more of all of you, and hearing from all of you through the coming days. And have a great evening, have a great morning and afternoon. And with that, I think we can go ahead and close down the event. Thank you, everybody.
Bye, everyone.
See you.
Thank you.
Thank you.